this is an easy way to get out to our businesses. This is an important topic of getting back to business. Our parish president, our parish council have been united in their effort to not only respond to the medical crisis that is before us, but also to make sure that our businesses are prepared to re-enter the economy and to do so in a safe and healthy manner. So we have a program today where we'll unveil the Jefferson Parish Back to Business plan, and we're going to be joined by some healthcare industry leaders to speak to the status of the health systems and our capacity to handle these cases. With that, I would like to turn it over to Mr. Todd Murphy. He's the president and CEO of the Jefferson Chamber of Commerce for some remarks.
Thank you, Jerry. I appreciate you putting all of this information together, and goes without saying the hard work that went into putting this plan in place. And so just want to point out that this is part of our Prosper Jefferson series, that is a education series put together by the Jefferson Chamber and JETCO. And we're proud that today's presentation can again be presented by OnPath Credit Union. So thank you all for your support, ongoing support of Prosper Jefferson. So the Jefferson Chamber, as you have probably seen over the past few weeks, has been advocating and really just trying to get communication out to our members and to our non-members alike about the payroll paycheck protection program, the SBA working capital loans that are available, some state loans that are available through the State Department of Economic Development. All of that information is available on our website at jeffersonchamber.org, and you also can reach out to me directly here at jeffersonchamber.org. In addition, the Jefferson Chamber has really been pushing for regionalism and how we can best bring our parish back in both a safe manner and one that jumpstarts our economy. I think the plan that you'll see today is one that is just some guidelines that it's really, if you take one thing away from here, it should be just a very common sense plan, a safe return to commerce. So with that, we'll go into the industry task force. So we have several different organizations that have been involved in putting this plan together. And please understand that this is something that is, you've heard that word 100 times, unprecedented. It is something that we put together reentry plans for hurricanes and storms and the BP oil spill, but never something of this magnitude. And so you'll see that we have government officials that have worked on this, from the parish president, the council, certainly the administration, the coroner, the sheriff. The school system has been a very integral part of this. Our medical community. Wow, how blessed we are to live in a community that has such a wonderful medical community and just Class A hospitals that have been part of this. Of course, JETCO has led the charge. The Business Council's been involved, and you'll see the other organizations there, from the Regional Black Chamber to GNO Inc., West Bank Business and Industry, and the Hispanic Chamber as well. You see several different professional service organizations that are involved. Elective medical, child care and early learning. I mean, that's a big part. We know we want to get people back to work, but we've also got to have child care available. And in the fall, we've got to have schools open. So this has all been factored into this plan. Manufacturing, construction, industrial, such a big part of our economy here in Jefferson Parish. The maritime and port industry. And God forbid, what do we do without the restaurants and the retail? And then, of course, hospitality, which is really a key driver of Jefferson Parish in terms of small conferences, recreation, swamp tours, and et cetera, Mardi Gras, et cetera. And then you'll see that we have some valuable resources, organizations, and websites. Ladies and gentlemen, there are a lot of resources available to you, from your individual councilman to your government agencies, your business organizations, just an abundant of valuable resources, and we hope that you'll take advantage of some of these that you see here on your screen. We also have some resources for personal protection equipment and testing supplies. There's some national resources for Centers for Disease Control and Prevention, for example, how to protect yourself, how to protect others. I'm not going to read all of these line for line, but you can get a good idea of all of the different emergency management tools and occupational safety tools that are available. So again, I would ask that, look at these as it pertains to your particular industry. And if there's something that you don't see that you're looking for, feel free to reach out to Jerry Bologna at Jetco or myself, Todd Murphy at the Jefferson Chamber, and we'll try to get that information to you. Again, we're very excited to put this guide out today. This webinar is being recorded. It'll be on the Jetco website and also on the Jefferson Chamber website, so you can go back and reference this at any time or forward the link to others. So with that, I would just like to again thank the staff at Jetco and their leader, Jerry Bologna, for putting this together, to our Jefferson Parish Council, and especially to the administration that's worked very diligently in putting this plan together. We are all very anxious to get back to business. We want to do it in a safe way, but we also want to have a very strong economy come back. And with that, it's my pleasure to introduce our Parish President Cynthia Lee Shane.
Thank you, Todd. And I want to thank, Jerry Bologna, Todd Murphy, all your staffs. We in government see ourselves on the front line of this thing, and it's just so wonderful to know that we have such strong partnerships with our business community on this. And I applaud all of you all for taking the lead. And this is an incredible document. We've been working on it with you. Our council members have been working on this as it led to this point. And for those of you who are about to see this document, you can see how much thought was put into it and how much research into the best practices for every industry. So I think it'll be an incredible working document as we come up on these next couple weeks. Our council, as I've mentioned, has been on the front line of this. They've been distributing masks. They've been involved in food distribution. So all of us are really working together. And one of the other things that I think Jefferson Parish has going for it very well is a very strong testing program. And we all know that is the critical component as we look to reopen our parish in the next weeks. The testing has got to be there, so we have really fine-tuned what's going on with the virus as we start stepping out. We've tested over 25,000 people in the parish. It is something that it is a very high number per capita if you look across the country, and it is a data point that we're very, very proud of, and we want to keep that up. And so the federal government was a partner to us in bringing in the Ilario Center site, but I also want to really thank LCMC for helping us do the walk-up site in Marrero last week. We got incredible numbers there, and also thank Ochsner for our discussions for some upcoming community sites as well. We in Jefferson Parish are an employer too, so we also are going to be going through the things that you're about to see in this document about how to bring more of our employees in and what we need to face to keep our employees safe, as well as our constituents that come in for services. So I know you think of us as government, but we are just like you in the same business model and have to do a lot of these same things. And certainly we're in that mode too of preparing for our offices to get more crowded. And the whole time we've been able to deliver our services, but certainly as we in the next few weeks, we know we will have many more people coming into our buildings as things start ramping up. And then lastly, I just want to commend everyone and say how important it is that we move as a community in these next phases, that we support one another, and that we certainly understand, the business owner perspective in wanting to protect an employee. And we know the importance of customers also feeling safe coming into, your restaurant or your retail store. That is the other part of this. If the general public does not feel safe, then my concern is the general public does not come to your business. So the more you can encourage people wearing masks as they come in, even your customers. It is a requirement now that employees have to wear masks, but I think it's just a good business model practice to even think about having your customers come in with wearing masks, because the other customers like to frequent places that they feel safe. And that is the environment we all need to create, because it's in all of our best interest to keep the virus very low in this community. It's an economic interest as well. So I'm here. We're all here. Our council members are here as we enter the next phase. And I appreciate the strong partnership we have across our parish. And with that, I'll turn it back over to you, Jerry. But thank you for your leadership, Todd, in this effort. And again, I'm very, very proud of this document with you. Thank you.
Thank you. And two quick housekeeping notes before we move on to our medical professionals. One, as we go through this discussion today, please note this is going to be a living document. It is based on research. It is based on much of the studies that we've done and the latest information out there, but it is subject to change based on the governor's guidance and parish guidance. And then finally, we're encouraging folks to submit their questions through the chat function, and we are going to do our best to answer as many of those questions as possible as we go through this. The purpose of our Back to Business plan is really twofold. One, to provide a roadmap for our businesses to get back to business, but also our function is to instill confidence in both our businesses and their customers to return to business. And we understand that a large portion of that confidence is going to be related to the capacity and ability of our local healthcare industry. And as Todd mentioned, we're blessed to have a very robust medical industry here in Jefferson Parish. And with that, I would like to ask first, we have Dr. John Heaton with LCMC Health, if he would make some remarks on behalf of LCMC. Dr. Heaton?
Try that again. Thank you. Slow on the mute. So I think that the healthcare industry is kind of like a lot of the other industries. We're trying to navigate what is going to become the new normal post-COVID-19. As many of you are aware, in the last week or so, we started bringing in more non-emergent cases that had been deferred, these time-sensitive cases, to get them done at our hospitals. And that's, we've had mixed results with that, to be frank. I think that patients, that was a strong indicator that people who do not have COVID-19 are still nervous about seeking health care. And unfortunately, this is manifesting itself in patients with severe illnesses, heart attacks, strokes, what have you, not seeking care until the last minute, with sometimes fatal outcomes. I know Dr. Satanovich has remarked on this and has had a press conference and some Facebook postings. But I think that what we're trying to navigate, and probably it would be useful for the folks on this call to hear, is that, all of our healthcare entities, us, Ochsner, East Jefferson, we have gone to great lengths to kind of separate our COVID business, which thankfully is dwindling quite a bit, and our normal, routine, customary emergency healthcare and time-sensitive healthcare. So I think that that's, the first thing to take away. The second is, as President Chang mentioned, I think it's critical that we continue to test and figure out where we are. We have been blessed to be able to do quite a bit of testing in Jefferson Parish and Greater New Orleans. As a whole, is one of the most highly tested areas in the country. That said, we don't have the greatest contact tracing. Nowhere in the country really has that nailed, but even with a diminishing number of cases in Louisiana, we don't have the infrastructure and the number of people and the number of trained people to get out and contact trace every person that tests positive at, whether it's a FEMA site or one of our sites or one of Ochsner's sites. So paradoxically, even though we don't have that ability to do classical contact tracing, I think the ability to test and identify people that have COVID-19 with little or no symptoms does achieve the main goal of contact tracing, which is interrupting the chain of infection. Because if we're able to call somebody and say, hey, your test was positive. You need to quarantine yourself because you're infectious. That, we hope, is contributing to our rapidly diminishing rate of infection. And I think that that's going to be an important consideration as we start reopening and employees start returning to work. And how do we encourage people that if they're feeling the least little bit ill with symptoms, to get themselves tested so we know where we stand. And also, as President Chang mentioned, the masking function has an additional layer of protection for our employees as we come back. So I think that that's the main things that I think that from our standpoint are important to get across to the business community as they prepare and plan for going back to work. I think we've talked about in the past and can certainly touch on again the individual preparations, but I think most folks are well familiar with the basic hygiene and social distancing and masking. I think that what we have to do now is how do we incorporate testing, and also how do we encourage people to get deferred health care before they get ill with some other illness that was entirely avoidable.
Thank you, Dr. Heaton. And now, representing Ochsner Health System, we're joined by Dr. Robert Hart.
Hey there. Thank you very much for having us today. And I think what we heard from Dr. Heaton and earlier from the parish president, I think one of our challenges is to build confidence back into our patients and our citizens that things are safe again if they take the precautions that we've been talking about and that you heard from Dr. Heaton. I think just to give you all an idea, certainly, and this is really what's happened across the country where you've seen these hot spots and real surges. Keep in mind, in the New Orleans and Jefferson Parish area, at one point we had over 600 beds filled with COVID patients. Now we're down below 250, and all of that is really within a 5-week period. So you see these surges, and it gives you an idea how the systems can be overrun, and that's what. In the back of our minds, we're in a much better spot now. We have a doubling time now here in Louisiana in the state of 47, 50 days. If you go back to early March, we were, at one point, we were sitting at a doubling time of around 2 days. So you can see how quickly those cases can surge and get out of control. But I think as we come out of this, we've got to make sure that we're doing all those things that Parish President mentioned, that Dr. Heaton talked about, all the things that we've heard about the hygiene and masks, to keep the cases from getting out of control again. Because there's nothing. It becomes a math problem, and that's really all it is. It's a math problem. We're nowhere near herd immunity. So once you begin to get it out in the community again, if we're not taking the precautions that we need to, it will in fact spread again, just like it did before. Now the good news is, and you heard this earlier, we're in a much different spot than we were 2 months ago. We have plenty of testing available. So with the right guidance, and we're trying to work, just as Dr. Heaton said, we're trying to work with the state, trying to work in the parishes to really have task forces go out and do testing. We're going to be doing several within Jefferson Parish, several within New Orleans, to really get out and start testing, because 2 things you want to know. You want to be testing where there's been very little testing, because you need to know what the background rate of the disease is and where it's just not being reported. And then you need to get into the hot spots so you can test where these areas are really taking off, so you can quarantine, self-isolate, get these people away, so you stop this kind of circular growth. The other thing that I think we've got to do in all of our business, and this gets back to that establishing the safety and the confidence is doing. I think one of the things that we're going to see more and more of is the temperature checks, the screening questions when somebody comes into our businesses. Certainly when we come into our hospitals, we're doing that. We want people to know that we're taking measures to keep them safe, going to be a lot more cleaning, that sort of thing, to be, to again, send that message, and not just send the message, but actually to be doing our part to keep things better and to diminish the spread of the COVID-19 until we have a vaccine, perhaps in 2021. But I think the testing, we're doing the COVID testing, which is a swab, a nasal swab, in addition to the antibody testing, which is a blood test. And the antibody testing, I do think this group needs to hear again that the antibody testing will tell you, if you're positive, that your body has mounted an immune response to the COVID-19. We don't know yet, though. There's been a lot of talk about getting this immunity passport, that sort of thing, if you can show that you have antibodies. This is a young virus, only 4 months old, so we don't know exactly what that tells us. Now, a year from now, we'll be able to tell you a whole lot more. But right now, we need to be careful telling people if they have antibodies. They're free to do whatever they want. They don't have to take precautions, that sort of thing. We still need to be taking precautions, not only for ourselves, but the concerns about spreading it to someone else. The other thing I think we have to address as businesses is how do we handle that high-risk population, the people over 65, obesity, hypertension, diabetes. I think those we're going to have to still consider options that are very low touch, maybe working away from the public as much. But I think we've got to take that into some of our planning, because this is a group where you see some of the bad outcomes, some of the real high risk to the COVID. So that's going to have to be taken into consideration as we move forward with this. But it's going to be, we have to continue to be vigilant. It's not over. Like I said, we're nowhere near herd immunity. So we'll need to continue to take these precautions that Dr. Heaton outlined, the parish president mentioned, as we begin to open up more and more to our citizens and our patients. So I'll stop there and let y'all consider. If there's any questions, happy to answer later or whenever we need to.
Thank you, Dr. Hart. And finally, from the healthcare community, we are joined by Gerald Parton of East Jefferson General Hospital.
Good afternoon, everyone. I just echo what the two physicians said. I'm going to talk a little bit about capacity. I think I know EJ peaked the first week of April, and I think that's true both for LCMC and for Ochsner hospitals. But at that time, we had 2-to-1 COVID patients versus non-COVID patients. Today, that's more than reversed. We now have 3-to-1 non-COVID patients versus COVID patients. In fact, for us, in the last 7 days, we've averaged less than 5 COVID patients, COVID admissions. As far as capacity, I think all of us have capacity. Like Dr. Heaton said, there's been a lot of fear about hospitals and people staying away from medical care when they should seek it. But for all of us, our clinics are staffed, open, and seeing patients. As we begin to ramp up last week with more non-emergent, we're doing this, and I'm sure every other hospital is doing this, so patients can be assured. But all admissions are being tested before admission, and even procedures, the patients are being tested. If there's a positive test, then the discussion is had with the physicians is whether or not it's life-threatening and we should go forward with the procedure or not. But every precaution is being taken at all the hospitals to make sure that we can keep this disease under control. and hopefully alleviate some of the fears that people are having about hospitalization and trying to get back to some semblance of normalcy, or as they say, the new norm. And I'll stop there, answer any questions anybody has later.
Thank you, Gerald. And I want to thank all of you for not only your time today, but being with us at every juncture as we prepare this plan, because we're very clear this is not a subjective plan. This is rooted in science and rooted in common sense. And we're thankful again for our business community and our medical community. So in terms of the makeup of this plan, like some of the others, we've broken it down into several sections. It includes general guidance for individuals. It includes general guidance for employers. And then we get into some industry-specific guidance before we get into the phasing of businesses as they stand right now. So with that, we'll just launch into this in terms of general guidance for individuals and general standards. These have been well covered. These are the things that we know as individuals, and these are things that have been suggested by the medical community and the CDC and other organizations as safeguards that help prevent the spread of not only this virus, but others like it. So we are encouraging folks to wear face masks when they're out in public. Of course, frequent hand washing with warm water and soap. That's preferred over hand sanitizer, but hand sanitizer is suggested in the absence of soap. Practicing social distancing wherever possible. This goes for individuals as well as businesses. The touching of face should be avoided. And these things all have been well covered, but we felt the need to reiterate those in our plan. Then we get into our general guidance for employers. And this is guidance that we suggest at a minimum. We understand that our small business community needs to instill confidence in their customers to return to the business. So we know a number of businesses have already discussed perhaps exceeding these general standards and minimum guidance, and they're going to take additional steps. But in all sectors across all industries, we are encouraging strict social distancing, maintaining at least 6 feet between individuals at work in the workplace, continuing to encourage where possible. This is difficult for many businesses, but where possible to arrange flexible working arrangements or teleworking, and then also importantly, encouraging businesses to have their own plan in place. Should a worker or a customer visit that business that is infected, how is that business going to react? Continuing general standards for employers. These include health and hygiene standards that ensure the business is taking the steps that they need to protect their workers and their customers. Things that, again, are common sense, but we need to reiterate those, and that includes cleaning and sanitizing frequently touched spaces, ensuring ventilation systems are operating properly to increase circulation of air, and then ensuring that businesses have the appropriate PPE for their employers or employees. This is where it gets a little more detailed, and that is the guidance for industries that have specific needs in terms of safety. And so we have issued a number of sets of guidance in various industries, starting with hospitality, increasing their cleaning measures, and ensuring that all of their employees are wearing the appropriate PPE and taking advantage of all opportunities to prevent the spread of virus. Restaurants, bars, and seafood establishments. This has generated a good bit of discussion in terms of what should restaurants be doing. We do know that the Louisiana Department of Health will ultimately establish some guidelines by which restaurants are able to operate. But in the meantime, in interim, we're encouraging that all staff wear masks where possible, requiring frequent hand washing, even up to and including even setting off an alarm to alert the staff or a buzzer to require them to wash hands at certain intervals. Menus to be disinfected after each use and or disposable. Discontinuing help yourself food items. This also goes in the hospitality section as well. Continue to encourage pickup and delivery of food items rather than in-person dining. Hand sanitizer, of course, at the entrance of every restaurant as well. For the retail sector, this includes strict social distancing, restaurants to implement decals perhaps on the floor where there is a line that forms, to ensure the social distancing, in cleaning, increasing cleaning measures, especially for touch points. This includes really encouraging businesses to migrate to more touchless point of sale options to cut down on the exchange of cards and cash. In sanitizing phones, headsets, and cash registers between each associate's use. And then encouraging the shopping mall food court entities to follow guidance as established in the restaurants, bars, and food service establishments. Theaters and entertainment centers. This is an area that we don't know exactly when they're going to come back because of the demand and when the demand will be there, but we have established a set of criteria for which theaters and entertainment centers should abide by. Salons, grooming, massage therapy, and personal care. I think everyone like me is ready to get their haircut. So we have established these guidelines as well, including requiring appointments to be made in advance, asking clients if they have exhibited any symptoms, the waiting area required to abide by social distance standards, the cleaning and sanitizing of capes and other things that are used in the process as well. Child care, early learning facilities, and organized youth activities. This is an important industry, we know, because many folks need to return to work, but it's difficult to do so without child care availability and those early learning facilities. So we have established very detailed criteria, which are minimum standards for those entities. And I want to remind everyone that we will have these posted on our website. Everyone can go to www.jedco.org and download the entire Back to Business plan. Places of worship is an area that the parish has discussed and how we order that in terms of the response, but we have issued some guidance in terms of our places of worship and the distancing measures and hygiene practices that they should abide by as well. And then we get into our phasing or our phased approach to the reopening of our economy here in Jefferson Parish, and to underscore the approach that we have taken is that we have abided by the Johns Hopkins matrix, which really outlines several sectors and their contact intensity and number of contacts. So it has helped us to order our phasing to make sure that we are, again, rooting this in science as well. So this phase that we are currently in is a stay-at-home order, and this requires stay-at-home except for essential businesses, and we have identified those essential industries allowed to operate in this phase according to the governor's proclamation. That includes critical manufacturing and industrial businesses, construction, transportation and logistics, essential healthcare and social services, pharmacies, food service with pickup and delivery only, although the governor did reiterate or did allow for outside seating without table service last week. Financial services, essential government services, essential retailers, agriculture, electrical and utility industries, petroleum, natural gas and propane gas, and then communications and IT. It's important to note that this is where we are right now. As we prepare to move into phase one, it's expected on the 15th of this month. It is possible that we might need to return to previous phases of this plan as we move forward. Phase one is what we expect to enter on May 15th. Phase one businesses will be allowed to open if they're able to implement the industry guidance contained in this plan. This includes capacity and gathering limits for phase one, retail, restaurant, and hospitality, and other business organizations serving customers within their premise should reduce their capacity to 25% of their total listed capacity as defined by the fire marshal. It's important to note that this is the guidance that we have as of right now. This could change. Those occupancy caps, which are set by the fire marshal, are subject to change and may be revised upwards. But it is going to be the purview of the fire marshal, as we understand it, to monitor those capacity limits. As is the case in the federal plan, the mass gathering limits in Jefferson will remain at 10 in phase one, so avoid socializing groups of more than 10 people that do not allow for appropriate physical distancing. So the industry is allowed to operate in phase one with the restrictions detailed in the plan include general retail, food service with in-dining, although restrictions are in place in terms of capacity and the industry guidance. Our general offices can return with the restrictions in the plan, as well as our hospitality industry, our expanded government services, professional services, personal care services, gyms and fitness studios, expanded financial services, educational services, childcare, and elective medical, along with places of worship, again, with restrictions in place. In phase one, those industries that will still not be allowed include bars, casinos, entertainment businesses, and places of public amusement, as well as organized youth activities and events, festivals, or conferences, or any other gathering over 10 people. Phase two is going to be the second phased entry of non-essential businesses. This will still include limitations as detailed in this document. We have a metric for moving into and out of these particular phases. But as we move into and out of each of the phases, we will continue to seek the guidance of our partners at Ochsner, LCMC, East Jefferson, and HCA Tulane. And it's important to note as well that the Parish Council and Administration reserve the right to divert from the plan if new guidance or data calls for revised actions. The capacity and gathering limits for phase two are anticipated to be 50%. That is what we're calling for. And again, that will be determined by the fire marshal. Mass gathering limits increased to 50 people with social distancing and safety measures in place in phase two. And phase two allows for all industries in previous phases, including now bars, casinos, entertainment businesses, and places of public amusement, organized youth activities, events, festivals, and conferences up to 50 people with strict social distancing and safety measures in place. And then the third phase of this reopening really includes everything previously listed, but also adds events and festivals and conferences up to 250 people in place. And we will continue to monitor the criteria for completing phase three and returning to full-scale operations for all businesses and festivals and activities in the parish. We will continue to monitor our healthcare system capacity. We will continue to partner with those entities to monitor this and make sure that at every step of the way, the parish is going to be able to provide for the health care of all citizens. And we cannot underscore that enough, that it is important that we all realize the physical toll and the health toll this has taken on our community. But at the same time, we are facing an economic threat, and it's important that we return to business in a safe and methodical manner. So what can we be doing now to prepare your businesses? We have about 2 weeks before the governor lifts the stay-at-home order. So we have several recommendations for you in order to prepare your business. And that is to continue to check on the latest information from your local resource partners. All of us at JEDCO, the Chamber, all of our partners that have been listed in this program continue to push out timely and accurate information. We know that's important to you. We would ask that you continue to monitor the COVID-19 resource page at JEDCO and at the Jefferson Chamber. What we are going to be doing on the JEDCO website is we are going to include internal and external checklists that we are going to encourage all of our businesses to place in their storefronts. And we think that this is going to go a long way to instilling some confidence in your customers that your business is abiding by these protocols, and then that signals a likelihood that folks will return to your business. We also are aware of a number of vendors in Jefferson Parish that have either already supplied or have pivoted to supply personal protective equipment, sanitizers, sneeze guards, and more. So we are keeping a list, and we encourage you to visit on the JEDCO website again, that list of Jefferson Parish companies that supply this material. And we also are encouraging everyone throughout this to really begin a campaign of shopping local and supporting our small businesses here in Jefferson Parish, as they are the lifeblood of our economy. We also want you to determine which guidelines apply to your business. So if your business fits in one of those industries that has industry-specific guidelines, please make sure you're abiding by that. Check in with your employees, make sure they are ready. We know that we're considering virtual orientation with employees to review these new policies. We encourage you to do the same. Make sure your stores and establishments are disinfected prior to returning to work. Make sure that if you need signage printed or other things done prior to returning to work, take these 2 weeks to make sure that you are ready to do that. And then finally, I would encourage you to communicate through your business and social media outlets as to what customers should expect, as to how you have modified your business operations. Help communicate that message, and also reach out to your partners at JEDCO and the Jefferson Chamber to let us know how your businesses have modified, so that we can help promote you as well. We have some internal checklists here. These are some examples that will be on our website for you to go through the internal checklist with your workplace. And then we have some industry-specific checklists as well. And these are examples of things that we would encourage you to post prominently in your work areas. And then also on your storefront, perhaps encouraging you to post something like this. These will be available on our website as well. Industry-specific checklists that you could place on your storefront with a QR code that will allow this to be downloaded onto people's smartphones to let your customers know that you are abiding by these standards. And that is the plan that we have for you today. We, again, are encouraging everyone to take these 2 weeks to make sure that you have everything in place so that when the stay-at-home order is lifted on the 15th, as we expect it to be, that your business is ready and not behind the curve. So with that, we're going to get into a few questions here that people have been submitting throughout the presentation. And I'll hit on the first one related to what is Jefferson Parish going to do to oversee violations of these guidelines. And I have a couple of thoughts on that. One, we're encouraging all of our businesses to abide by the guidelines. We implore them to utilize common sense and responsibility in getting back to business. But as stated in the presentation, the occupancy guidelines are the purview of, those are established by the fire marshal, the state fire marshal at this time. So that will be the responsibility of the fire marshal. In terms of mass gatherings and limits on the number of people allowed to gather in mass gatherings, that would be under the purview of the Jefferson Parish Sheriff's Office. So we would encourage folks to handle that through the Sheriff's Office. And then restaurants, as I mentioned, they're going to be under the purview of the Louisiana Department of Health. So any complaints about enforcement on safety measures in restaurants should be directed to the Department of Health. Looking at some of the questions here, one of the questions is our plan differing from Louisiana Association of Business and Industry, or GNO Inc.? I want to mention that this plan has been in development utilizing research, and I want to commend the JEDCO staff for the time and effort they've put into this. But our plan is more acute to Jefferson Parish. We are offering this plan to the parish and the parish council and parish president for the official plan of Jefferson Parish. The plans submitted by others are a bit higher level in nature, but this is specific to Jefferson Parish. We have taken into account the federal plan to reopen the economy, and we have been in consultation with the state and many of the departments within the state to inform this plan, but this is the plan for Jefferson Parish. One of the questions is, what if an employee gets sick and tests positive? What should a business do in response to that situation? We are encouraging, and this is the CDC has some great examples of how to handle this, but we are encouraging you to take these 2 weeks to put some policies and procedures in place. Each business should have a policy in place to not allow employees that are exhibiting symptoms to enter the workplace. If someone has been in the workplace and is infected, you should have a policy that talks to how you should accommodate that employee, in encouraging them to stay out of the workplace for so many days. And I would encourage you to go to the CDC for that plan.
Paid sick time for other reasons.
I'm just looking at the next question here.
One question I got, Jerry, was at what point will you and I resume video conferencing? And the answer to that is when the barbershop's open.
Good answer. I believe the medical professionals touched on this, but can anyone speak to the weekly death rates. I know our numbers in Jefferson Parish have trended down, as has the capacity for the bed occupancy. But can someone speak to the rate of death in Jefferson Parish?
The mortality rate? I can't.
I will, this is Dr. Hart over at Ochsner. I will just say that the death rate is usually a little bit of a lagging indicator on the disease process itself. So, I mean, you could easily see the number of cases. And again, the guidance that you laid out really tracks the number of cases coming down over 14 days. So the number of deaths will probably lag behind, even as you begin to see those number of cases come down over 14 days. The other thing that I think we all, and this is, this is living in Louisiana, and this gets back to our baseline health status. One of the reasons our death rates has been what it has been is because we have a population that does have a fairly significant number of comorbidities that put many of us at high risk. And so that's, again, part of this equation. So hopefully that helps a little bit. But I agree, the public, we've got to, that's what's going to make it even more important for us to stress to the public and make it clear to the public that, we ought to be out announcing cases coming down as they come down and making this real clear, wearing our masks, doing the social distancing, doing everything we can to instill the confidence again in the public that we have this under control as we go forward. So it's going to be very important.
Thank you. There's a question regarding is the parish monitoring price gouging, as PPE is not a budgeted cost for many businesses, and that is under the purview of the State Attorney General, Jeff Landry. So they have been running a number of public service announcements regarding that. And if you want to go to the website at the Attorney General's office is ag.state.la.us. And then there's also a consumer protection hotline at 1-800-351-4889. Or on the website, you can fill out a consumer dispute form as well. There's another question regarding the metrics being used to move from phase 1 and phase 2. The metric to be that was used to move into phase 1 included at least 14 days of declining cases. There is no specific hard number in order to move from phase 1 to phase 2. We anticipate that will be established by the governor's office again. But we will monitor that, and the parish administration and council will also be monitoring that as well. And again, the parish council and administration reserve the right to divert from the plan if new guidance or data calls for that as well. With that being said, that brings us to almost to 2:30. Todd, do you have any closing remarks that you'd like to make?
I guess the only thing I would say is, again, that, Jerry mentioned that this is a fluid plan. This has been put together by industry experts, and then a lot of us just with opinions based on experience. It is subject to change, possibly to be upgraded. It's going to be a working document as we move through, and we would just ask our businesses to, when in doubt, please use common sense and let's get our economy back and growing as quickly as we can and as robust as we can. Thank you, everyone, for taking this very seriously and taking the planning process seriously. We have about 2 weeks to get ready.
Thank you, Todd. And just as we close, I would encourage everyone to please visit jedco.org to download the plan. You can view the entire plan, and we will also have, again, the checklist for specific industries there. We encourage you to place those on your storefront. And then I would be remiss if I closed without, again, thanking my partners here, collaborators in the Jefferson Chamber and Todd Murphy, Tim Coulon and the Jefferson Business Council, the many task force members, and the Parish Council for providing the leadership along with Parish President Cynthia Lee Sheng. I want to thank you, and then notably thank the JEDCO staff for all of the time and effort that went into the preparation of this plan. Thank you all for your attention today. Enjoy the rest of the day, and let's get ready to get back to business.